Good evening, everybody. Welcome in this webinar, and I'm very happy to introduce the webinar of today. Today, the topic, the webinar is Opera Rev and his technique. With me, Dr. Maria Grazia Crocia, and she introduced you the product and the technique, B.A.P technique. Thank you, and see you soon for question greetings.
Hi to everybody. First of all, I want to thank Simone for the kind invitation on this webinar. And let's go through these items. I'm going to show you our new product, and we can realize a new kind of biorevitalization with hyaluronic acid, a new kind of hyaluronic acid, and a new technique of injection. First, I want to show you a photo that is summarized for our product and the elasticity properties of our Opera, that is our new kind of filler. In this photo, you can see the reality of our product. Opera is a sterile medical device, injectable, hyperogenic and absorbable, based on cross-linked hyaluronic acid. We have different kind of product with different kind of indication. Just to sum up, we have 5 formulation from Opera 1 to Opera 5 for treating all the kind of wrinkle located in the face, and the particular Opera 5 for treating body. But today we are going to show you a new kind of product, Opera Rev, that is a particular way for obtaining revitalization of the face and the neck. What's new? Talking about skin biorevitalization, we know that is a treatment concerning into the transdermal skin injection of different substances such as vitamins, hormones, enzymes, hyaluronic acid and plant extracts, just to stimulate fibroblastic biosynthetic capacity and facilitate cellular interaction. The aim of this kind of treatment is to increase the production of collagen and elastin, to maintain or regain, for sure, a healthy and youthful appearance of the face, and to obtain a restoration of face volume with the reduction of wrinkles. Indication, we can use this kind of treatment for all of our patients, female or male one, and from young to older one. We can treat various degrees of skin aging, skin dehydration, loss of tone and elasticity, dull or uneven complexion, and to maintain other treatment, other medical treatment. The technique, the traditional technique, concern of intradermal injection reaching a depth of 2 or 5 millimeters. We can go straight to 10 to 15 millimeters, reaching dermal epidermal junction injection, or we can go to subcutaneous injection, reaching a depth of 1.5 centimeters up to 3 centimeters. But let's talk about Opera Rev. This is an hyaluronic acid with a weekly cross linkage that make this product suitable for the patient who want to obtain a delicate but effective effect. And its bioabsorbable properties makes this kind of product ideal for correction of minimal facial skin depressions. On Italian market, we have competitors, and I'm going to show you profile from IBSA. During the presentation, I will show you some differences between these 2 products. Talking about B.A.P technique, we can note that there is an important difference from the traditional technique and the B.A.P technique. During using the traditional microinjection technique, we have to do multiple injections all over the face of our patient. Using a B.A.P technique, we can do just 5 injections for any phase, obtaining a minimal discomfort from the patient. Talking about the protocol, usually I do 1 treatment monthly and 2 or 3 treatments during all the year. Talking about B.A.P technique, what is B.A.P technique? B.A.P is an acronym that means bioaesthetic point, and it permits to treat with just 1 treatment full face, all the face. We have to do 5 injections for any phase, you can see in the design, treating a safe anatomic point, choosing avoiding large vessels and nerves. This treatment permits to obtain maximum results with a minimum number of injections, and it is very, very comfortable for the patient. I'm going to show you the point by point. First point we have to choose is located on cheekbone protrusion on zygomatic bone, at least 2 centimeters from the external eye. Second point is located at the intersection of a line joining the wind of nose to the tragus and the line passing through the pupil. After I have some patients, so I'm going to show you the real way to obtain this point. The third point is located 1 centimeter anteriously to the tragus. Fourth point is located 1.5 centimeter laterally to the line, passing through the center of the chin, choosing 1/3 of its height. And then the fifth point is located 1 centimeter above the mandibular angle. Talking about the amount of product we have to use, we can treat the patient with 1 ml of solution. 1 ml as 20 milligram of hyaluronic acid. So we can choose 1 ml for section or 2 ml for section, up to 3 ml for section, according to the grade of wrinkle the patient had. We can use 0.5 ml for hemiphase, using from 0.1 to 0.2 ml for any B.A.P. Another important thing to consider is the depth of the injection, because these are not superficial injection. We have to reach a depth of 6 to 7 millimeters into the skin. And due to the particularities of the product, we can use a very small needle, just 30 gauge needle. Talking about effects of this product, we can obtain a restoration of a fibroblastic function to produce new collagen and new elastin fibers. We can obtain a reconstitution of the extracellular matrix with a better hydration. We can enhance all the cellular activity and compensate the hyaluronic deficiency. I'm going to show you some photos of patients of mine with this product. In the first photo, you can see a patient treated with just 1 session of Opera Rev, obtaining an important improvement in all the hydration of the skin, particularly with this particular dehydrated and dry skin and sensitive one. You can see an improvement in this area just during the treatment. This patient was treated with 2 sessions of Opera Rev, obtaining an important improvement in all the middle face area and I complete the treatment with a filler in the nasogenial area, but this area has a completely improvement just using Opera Rev alone. These other patients has an improvement in aeration, and we can see an hyperemia and enlightenment of the face in this area, in the zygomatic area, and an important reduction of a wrinkle in this area, cheek area. Can we use this product on the neck? Yes, we can use it. And as you can see in this photo, even when the patient is a skinny neck, the point immediately after the injection are very, very negligible. So the patient can come back to his normal life, to his work, to his home without any particular sign. So for now, just by now, I want to thank you for the attention, and I'll wait for showing you this product on my patients.